welcome everyone to Platforce Live, Field 30. Today we're not using slides and we're not doing traditional production presentation. So instead, what we will do is two things. First one is we will have a conversation about something every pharma team is dealing with right now. So basically how actually track what's happening in the field. And then I'll show you how it looks like in real execution, right? So this will be something, real conversation followed with a real workflow. And to make everything more real and very interesting, I'm joined today by Stefan Turnwald, who works closely with pharma teams and field execution and content performance. And he's the managing director, founder of CCon. Stefan, welcome, and just some words for you.
Thanks. Great to be with you and looking forward having an interesting discussion on CRM from the perspective of the field itself.
Awesome. I appreciate it. So just to break the ice, just to start, just not a pre-warning, but since this is the first, event, if something goes not the way it should be, so I highly apologize for that, but I hope everything goes well. So Stefan, question to where do you usually see gaps between the reported activity and real execution? That would be very interesting to hear your point of view.
Yeah, for me, the key question is not what metrics, what KPIs are good for. The first question I usually ask is, whom is this information relevant to? So in other words, KPI are very much related to a level or a function in the organization. Senior leadership may look for different metrics as franchise heads, as marketing managers, as field leaders, and the reps themselves. So the key question always is, if you have a metrics framework, is a metrics framework allowing each and everyone to get the information required to come up with their own relevant decisions? So whenever there's a gap, in most of the cases, it is the gap because some of these needs are covered while others are left out.
Okay, that's amazing. That's a great point because usually the way pharma and reps work, they get pushed with information, right? So they receive a ton of information that they need to provide, and there's sort of also I recognize there's less space for personalization, right? So not only just working in a gap like executing procedure 1, 2, 3, 4, but also having something personal that makes also the conversation more real. Even we are talking about the terminology of certain products that needs to be executed because of marketing, because of sales, and that's understandable. So yeah, I mean, that's a very interesting point from your side, and I think our watchers and people who will join later on who will review it will probably recognize as well this kind of pattern. So let's do it this way. So the big question becomes basically, so what would it be like to have data captured naturally, right? So during interactions instead of after. So this is the main question, which is all concentrated more on the rep, him or herself. So when we go into more deeper into it, what I would like to do is basically to have, instead of answering theoretical theory, we can actually show everything. So basically, in this case, I would introduce how actually it starts. And I know many of you know about it, how a rep starts. So basically, they go out in the field, they have already a list prepared with visits and so on. And just imagine we have a doctor that needs to be visited by the rep, right? And what happens is we, prior to the visit, also, as you mentioned, Stefan, we would require some information if it's the first time a visit. And in this case, what I would do basically, I would just simply switch over to my iPad just to show. And then I will also get your feedback as well, because it's quite interesting. So, okay, so you just let me know if you can see my screen. Okay, broadcast, I will check as well. So here we go. Okay, perfect. Looks good. Okay, looks very good. Okay, just so just imagine the way how actually it works. So we have our tool, in this case, Platforce tool, and our rep starts the day. The first thing is we have on the left side the activities that are planned today. You can see there are certain completed, of course, but then we have one which is actually assigned to us. Either we created or it was assigned. Now, the most important thing is when we have something assigned, we need to get the information about this person, right? Who are we visiting? So I'm just gonna go on Abraham Lincoln, click on it, and what I will see is there's a lot of information at the first glance, but I want to check out, for example, the person itself. So I can actually go into his card. I can actually check out information, contact details, if there's any kind of targeting strategic priorities that we can actually mention during the conversation with the doctor. And we can also fill in this information as well. It's one of the things, right? So after the call, we can actually go into the contact details and update this information. But before doing this, we want to also, an important feature is for point, especially here in Europe, is regarding the GDPR compliance. So we want to know if the consent is actually taken from the doctor or asked for by the doctor, or we ask the doctor. So we can actually go to contacts. I've already prepared something, but we can actually check out the doctor. We can go in, and then what you see in the center, we have the status, so it's obtained, right? We have the expiration date on it, so everything is good to go. We can actually collect the KPIs. We can actually also send out materials to this doctor after the conversation. And let's start. So I'm just gonna go into activities for today. I click on them here. Important is that when we start the conversation, the main thing is to keep everything organized. You need to have an overview and understanding what's actually going on, with who we talk, who talked with this doctor, if we have any kind of outcomes in the past. And then we can also see, for example, we want to talk about our product scope element, and we have in the end a little survey, right? Then we see all the previous calls that are also important to see, because like we understand, okay, there was like a representative who actually had this conversation. We have the HCP insights that can be also like reviewed and shown. Any kind of previous visit results. Here we have, for example, a very simple one, introduced to a new product, but this can be actually outlined with more text. So that means if we need to talk to the doctor more in depth, we have key messages that can be delivered. We have intake form. So basically here we can see if there were any kind of questions last time when we had the conversation, if they weren't actually answered, right? So we can actually go into them and go through. And old orders as well, if we performed contact characteristics. Now, this is something, Stefan, it would be probably interesting as well, because here, based on this, we can either see already filled in information, right? So that means if the managers or previous calls or visits, we actually added this information, or we can actually add additional one. So we can actually then choose, so we can actually understand, okay, if they want what channel preferences. As an example, we have face-to-face, we have remote call and Telegram, right? If we have, of course, the consent for that. If we don't, we shouldn't do that because it's against regulations. And then we can actually see also the organization characteristics. But for us, it's important that we want to start the visit. So we got the information, we walk in, we start to talk with the doctor, and then we basically go ahead and start the conversation. Now, the interesting thing is that when you start the conversation, we choose, for example, the product that we want to show. And here, that's where basically sort of the magic happens, right? So we start to talk, we show them the presentation, and it's important to understand one thing. The leading person in the conversation is, of course, the rep. And this person is not only like reading the information that is given to him or passing on this information to the doctor. They have their own approach to the doctor with the information. So basically, the tool is helping the rep to get more organized in terms of the main information, but everything else that he collects during the conversation or wants to add. This is from his side to keep it more personal, and maybe you can say something about it.
Yeah. What you are describing right now is how the CRM tool Platforce here is helping the rep to prepare for an engagement. So if being tasked to see a physician, there are a set of questions that require answers. One question is, who is this physician? And I may have more than 100, in some markets up to 300 or even more customers I'm seeing, and not in every one of these customers I know by heart every little detail that might be relevant. So the CRM helps me to get myself up to speed. I remind myself of who this customer is. I can understand what are the preferred communication channels and what is available in terms also of consent status. And I also learn from the system what the strategy with this customer is. So what are the tasks in terms of product communication? One important aspect is the self-understanding of the role of the rep and how a role of the rep is also seen from the headquarters perspective. Because if a rep is just delivering messages, then a rep executes within this framework. If a rep is more considered an engagement platform that needs to earn the right to engage based on relationship and trust, a rep is now easily provided with all the relevant information to get started preparing himself or herself to be ready to further tailor the information to the individual customer in the context and the moment of the engagement. This is exactly what you've been describing. There are screens I can show, I can share, but these screens support a conversation I ideally adapt to the individual customer in the flow of the conversation.
This is why I really like to have the conversation with you, because you see it more from a rep side, right? So it's not only just like the tool itself, but you see it from a rep side. And this is also important that we combine this kind of things. We combine the technology and the rep, because we cannot do one without another one. We can. It's impossible. It's impossible, because both tools interact. Ideally, if everything is fine-tuned to each other's needs in this case, So I appreciate the insight from your side, or your view on it, because this is also very important. And so we have the conversation, right? So we talk with the doctor, and the cool thing is that we operate already, and we already collecting KPIs, right? So for example, if I go through the slides, we talk, and I represent something, and we are already having the information such as on what slide, how long we stay on our duration, if it's liked or if it's disliked. So if the doctor doesn't like it, we don't ask him, can you repeat this? Pardon me, can you say? We say, okay, he shows any kind of negative reaction towards the slide or even the product. So you swipe down, say like, and that goes into the KPIs. So it's like, okay, the doctor does not like this slide, so marketing needs to do something else to get more relevant for the doctor. And as we go through, we have as well like several slides we can actually go through. We pass on, for example, as well the device. We switch to another slide. And we have here, for example, certain information that we can actually give to the doctor. It's not about just talking, like as you said, it's also the conversation and having this interaction that makes it very interesting. We pass on the device and then say like, okay, how do you think about that? And it's like, okay, we have 0, 100, here we have 51, and we make it. And that goes as well towards the KPIs, right? So we have already collected the KPIs. And what I'll do is basically, as a rep, we want to wrap it up, right? So I go ahead and then I simply complete the call or the visit in this case, right? So we can actually complete the visit, say yes, and we don't choose, for example, we have other options of choosing, for example, additional information, such as showing them maybe a survey, like we could show them a survey or even other materials. And important to mention is that when you have the conversation and you understand that the doctor is maybe interested in something else, you might be also able to switch to some other products from the same brand. So you say, okay, they don't like, he doesn't like scopolamine, but there's another product. So you can actually switch to it and then also work. So it's not just bound to one product, but that gives you the limitations, like left and right, you can't move, you just go straight forward, but then you can switch to another presentation and also collect the KPIs. So basically, that's the most important thing. And then when we finalize everything, right? So we have the call results. We can actually input the information immediately. What was actually the outcome? For example, call results. What we maybe gained any kind of insights from the doctor. So we said like, got some additional information. Just type in fine as an example, and the next goals. So we would probably, if the doctor didn't like the product, we say, okay, marketing needs to research a new, for example, approach for this doctor regarding product BB, ABC, and so on. And we can actually input this, like, so I just put in Laurea Ipsum in it. And basically after that, we have also questions. Like sometimes happens, and Stefan, that sometimes happens that you will get asked a question and you don't know about it. And not to play like saying, oh, I know everything. I said, okay, let's discuss this by the next visit. I will check this out. So you can also use the intake form, for example. You can add the information there, and then you can later on reply to it when you have the new meeting with the doctor. Now, we have now completed it. So we say, okay, we have all the information we require. We see everything here, and we complete the call. We get the signature from the doctor to finalize everything, and voila. What happens is we finish the call, as you can see, in activities for today. And if we go into the call itself or into the visit, we can see, for example, the call results that I inputted. And that's the great thing for reps. They don't need to put in a lot of information in. Most information is already collected, so we know what slides the doctor likes, how long we stayed. Marketing can analyze this data, right? When you switch between the slides, how long you stayed there, and additional information that you collected by yourself. And then what happens is, if we scroll down, we get like partially the KPIs that can be reviewed here. But the most important thing is that the system is automatically basically doing the synchronization. In this case, what I will do is I will simply start the synchronization from my side. Why? Because I want to show now we are now the rep, but I want to be now the manager who is actually checking out what actually the rep did. And I just gonna switch off the 1 second. Just gonna stop sharing the screen. Here we go. Maybe you have something to say, and I assume you have.
Yes, and you mentioned it in the end, because bringing in the manager, this is the first other level, other perspective on what has happened during this conversation than the rep, him or herself.
Yeah.
And on purpose, I set up this framework of metrics and KPIs in the beginning, and every level has a different preference for KPIs because they have to come up with different decisions. And very important is, if I'm a rep in the field, I do not want to be bothered with all these metrics I don't care for. Or I even may understand as a burden because it feels as if I do monitor myself from a different perspective. So if this is all handled in the system, if this is not an additional effort I need to put in, this is a lot of help from a rep's perspective. On top of that, I also need to be able to track information in the system that is relevant to prepare myself for the next conversation or to properly follow up on what has happened. To me, just doing it in an automated way is not necessarily the solution. And I like to use the comparison with Microsoft Teams. If now you use AI to wrap up your Microsoft Teams conversation, what you do is you copy the output from AI and you file it. You don't spend a single brain cell on what has happened. If you had to do it manually, at least you've been thinking through what has happened. And for the rep, it's the same thing. There are aspects that do not require the rethinking by a rep, but there are also other aspects that
Yeah.
are important to be taken care of. And if the less relevant things for the rep are automated, there's more capacity to do what really matters.
Exactly, and that's the conversation, getting more information and bringing over the product
Yes,
away. It's not just like
yes,
a slide or a
yeah,
presentation, and
yeah,
that's very important. So when we finalize everything, right, so we have the first is the, for example, back to the KPIs. So we have the first, the content performance, so we can actually
yeah,
see what slides were reviewed, as I mentioned before. Then secondly, we see the engagement metrics, which is also very important, because here we can see the click interactive elements, because this can be built into a presentation. So the doctor doesn't sit there and listen to your information waterfall,
yeah,
and also responses to questions asked. Third is the call itself, right? So it basically captures all the information, so duration. We got the visit type, because like we have different visits. We have events, for example, we
yeah,
have
yeah,
big meetings and stuff like
yeah,
this. And over the time, it basically kind of like helps to identify the patterns for the future. So you kind of know, okay, we have this product and we can proceed the way how it needed. And finally, it's the field efficiency in this way as well. So managers can understand, again, it needs to be divided, right? So it's not just for control, but it's also to see, understand how many visits were done, right, during the day. What's the coverage for the target HCPs, right? So
yeah,
and route effectiveness. And now what I would like to do is I would like to share the screen. Let me, and your input is amazing. I love it, Stefan. I really love it. So give me a second, and you just let me know if you can see my screen. You can see it,
yeah,
right? Okay, awesome. Now, just imagine we are now the manager, right? So we finalized we are working there, and we want to see what actually is going on in the field. So I go to actions, right? And here we can actually see that we have if the call, okay, for whatever reason, that's very interesting. This is what I said, like if it's not working, and that's funny, because I was making the synchronization, and that needed to be happened in the first event, But let's imagine it did happen the way it should happen. So basically, the we have to complete the call, right? And we can
yeah,
actually go into it and say, okay, let's check out, for example, the conversation we had, right? So let's go into, as a manager, we will see, for example, the call itself, so we know where it was, when it was completed, when it actually started, which hospital, etc. We see the characteristics as well, right? So all the information that's been filled out, but we want to go into KPIs. And in the KPIs here, you can see that I will be um, I will be able to see, for example, okay, we have the scope element presentation, the product, how many seconds with duration we stayed, the slide name, the reactions as well. See, they're already mentioned. So that means if we like the slide or the doctor liked it, we can actually also, based on that, have the information and collect it. And as well, the partial information, that means if you have like a survey or any kind of information that you pop up during the conversation and the doctor actually fills in, you can actually see that. And then importantly is that you have your dashboards, right? In the dashboards, you have, for example, the usage content KPIs, etc. You can actually adjust this the way you need it for your company, right? So you can actually review who was doing what is actually the frequency, etc., and so on. And that's basically how the system actually works. So I'm just gonna switch quickly to the screen so I can actually see. And overall, so what is a visit? So the visit becomes basically insights for marketing, right? The visibility for management, and an understanding for the guidance for the next field trip. I wanted to say the field visit, and
yeah,
that's basically the entire information. So we cover with our tool, and I give you a word as well to you,
yeah,
Stefan. So we have the regulatory compliance. So we ensure that
yeah,
constant tracking, audit, we will see everything, the GDPR compliance. Secondly, important also the better engagement. So with healthcare professionals, we have that in mind of communication becomes more like data driven, personalized, and relevant. And you can then add as well your information to it. Then we have the third aspect, which is the rep efficiency. So less reporting. We don't need to put in too much in. And as you could see, I was just talking. I had to collect the information. I just needed to type in some information that is relevant, and that's
Yeah.
it. So more time for the doctor, as you said.
Yeah.
And the fourth one is the real-time decision making, right? So you have the conversation, and what works if the doctor doesn't like the presentation, if they don't like the product, you can actually switch to another one and go from there
Yeah.
on.
Yeah.
And finally, and then I will pass it on to you, it's the better marketing ROI. So instead of like guessing which market works, teams see exactly which content performs, which messages are resonating, and as well where to invest should go. So that's kind
Yeah.
of the approach. And I would really love to hear your feedback on it. And by the way, guys, you're listening, you're watching, maybe somebody will later on uh, rewatch this, and hopefully it would be awesome from your side if you could actually input from which side are you actually. Are you from the rep side? Are you from marketing? Are you the management? And what would you like to see? Because this is based, since this is the first event, based on this, we can actually also tailor the, how to say, the pain points for those who are actually operating in the
Yeah.
field, not only in the field, also in the, say, in the management and marketing and so on. So leave a comment and we will get back to you. And now I'm going to turn over to Stefan.
Yeah. Thanks, Andre. From my point of view, and we framed the whole conversation also from the perspective of looking at data.
Mhm.
Data, metrics, KPI, data-driven decision making. What is a critical aspect when launching a CRM to the field force is to be clear on the metrics you track and to also be transparent on what happens with these metrics. So, as a chief financial officer is not interested in call quality. A financial officer is interested in what he gets out of the investment into a field force. Yeah, and this is why call numbers are relevant. But there's no rep in this world who wants to be just looked at by call numbers.
Exactly.
On the other hand, there are key messages and story flows provided by marketing, but every seasoned rep knows that just by casually dropping key messages, you don't win the business. Yeah. So if a system supports the rep in what a rep is doing and takes off the rep shoulders what's not in the key focus of rep activities, it's a great win. If in your organization you're transparent on what a certain metric is used for in the back office, so there's understanding by the reps why is this collated and what happens with it, you also will get buy-in by the field force. But then the other aspect is always consider what is the relevant information you ideally should have in a CRM that helps the rep do what only a rep can do. And this is individualizing a communication, a brand communication to one customer in the moment and the context of an engagement. This is what no marketing engine can do. This is what no historical data can provide, even on the most advanced analytics. This is why we have reps in pharma. And if you consider these aspects and if you're transparent across this metrics and framework of metrics and KPI, I think Platforce offers a great tangible solution, easy to manage, easy to use, that provides support not only to the back office, because usually the decision is made there, but
Yeah.
also for the field where it needs to be adapted to really develop dynamics and traction.
No, I appreciate that. That's very interesting. Nowadays, thank you very much for this information. And in general, like, um, as you said, like, too many. It's not about the KPI because the winning horse is always the reps because they are the guys or girl, boys who go out.
Yeah.
Depends on, it doesn't matter, but they go out, and here we don't need to put in those covers. Like, for example, I always like to say, like the cows or horses have. So you just go straight one line.
Yeah.
You need to have
Yeah.
a brighter view of everything. And
Not to be honest, there are tasks in the field
yes.
that exactly demand that. you need to have a certain consistency in brand development messaging, for example.
If
But
it's
then,
healthy, if it's
yeah,
healthy, if it's
exactly. But
healthy.
then there is this other aspect of really understanding a customer in the treatment of one patient in need.
Yeah,
And this is usually much granular than the level brand stories and key messages are provided.
awesome. I really appreciate it. And look, it's already 30 minutes, just flew by like this, you know. Stefan, thank you very much for being on
Welcome.
this first event. I really appreciate it. Your insights are always helpful, and they're like they're, the views, it gives a different aspect. And to our viewers as well, as I mentioned, please submit your questions. It will be very interesting to read them and to reply to them as well. And thank you very much to everybody who joined, who was actually today with us. And stay tuned for the second one, which will upcoming. So we will inform you. So thank you very much. I appreciate it.
Thanks.
Thank you, Stefan. Bye bye. Have a nice
Bye.
one.